can we turn to protection? Reader Ken Chu asked, we hear about vaccines being made. Sometimes we hear in a few weeks we've got a vaccine that's going to be ready, and then somebody else saying, no, it'll take at least a year or so. What is the real answer? Are vaccines something we'll see over the next few months? And when a vaccine finally comes, will that solve all our COVID-19 problems? Tiki.
Since I sort of spent a lot of my career working on vaccines, I have two views on it. And the overall view is that looking at the situation at the moment, it is not necessarily a magic bullet in the context of, public health measures and the search for a drug. And I say that for two reasons. Once again, we still don't know enough about whether a vaccine will sort of induce immunity, which can neutralize the virus. That's still a big unknown.
If it doesn't, it's not a vaccine, is it?
Exactly. So that is an unknown. The second thing is something that's sort of dogged the dengue vaccine, the possibility that if you introduce a vaccine, you may introduce a phenomenon where the antibodies will actually make the disease worse. And there is some initial studies that antibody-dependent enhancement, this is the phenomenon, may be happening in some of the early studies in vitro, at least with this virus. So it's early days, but of course, people do think of the vaccine as a magic bullet. And in the case of the Ebola vaccine, that's proven to be very sort of effective in trials. But in this case, I think the jury is still out.
So we should be a bit careful. Yes, Liang.
It's important to understand that people are announcing candidate vaccines, and these have to undergo testing in animals first, and then undergo 3 phases of human trials, which will take over the course of a year. And at any point, the vaccine can possibly fail.
Right.
And even assuming
saying that, yes.
So if everything goes well, then you still have to make enough vaccine because every country will be queuing up to buy them.
It can fail on a variety of different counts, as Tiki has mentioned. It can fail because it's not effective at all. Of course, even if it's a vaccine that gives us partial immunity, it's better than nothing. But you can have a vaccine that's produced, looks promising on paper, but spectacularly fails because it doesn't help us or protect us at all. Then the vaccine can fail because it's in fact very dangerous and harmful. There may be side effects that can be in fact very severe. You can even die from those side effects as well. And either of these would in fact render that particular vaccine as not suitable for use in humans or in large populations. If we look at the timeline when we start off with a candidate vaccine and then work that through all those studies until we reach a stage where we're confident it may be something we can use in populations around the world, that would be more than a year. It could easily be a year and a half, 2 years. And there are some conditions that have been with us for long periods of time. And there have been many companies trying to produce vaccines, and they've so far not been successful as well.
Well, I'm a strong advocate. I think we truly have to look into able to leverage on the technology today to be able to hasten certain development, and vaccine is one of them. We may not have the perfect vaccines, but I think it will be a very important start for us to look into vaccine development. And this coupled with our own Singapore local system in terms of how we can slow down or retard the transmissions. And therefore, by us sometimes, should one day we have a good and effective vaccines, we can use it for the entire populations. A few things I just want to quickly mention. Apart from vaccines, there are other developments we have to look at, including how do we develop new drugs, new therapeutic approach for the patients. And the other one is a test kit. How can we have a better test kit so that we can use it in primary care, we can do it quite easily. And those are the technology I hope we can put in a lot more effort and research to be able to help us in the entire scheme of things.
Yes, actually one of our readers, ISWE, was asking whether GPs could all have the test kits, because we keep hearing about people who've gone to 2 or 3 doctors before they are identified. So that poses a danger actually.
Yes, so it is something that we do not have today, but I think it is important for us to spend a lot of energy, resources to look into whether or not we can develop it one day that it can be deployed into.
How about the 3-hour test that we are doing at the borders?
Well, that is not a point of test. It is still RNA, it's still a laboratory-based test. So the 3 hours is basically for the entire things to run. You put into machines for the entire things to run, it takes about 3 hours. So it's not really a point of care test.
Right.
Perhaps to explain that a little bit more, the current test that we have for diagnosing COVID-19 is a lab-based test. We call that a PCR test. And actually, the test that we currently do in the borders and we do in our hospitals, in fact, it's a very similar test. I mean, we can tweak it. It's produced by different companies, but effectively, it's the same test. Each time you do a test, it will take roughly something in the order of between 2 and 4 hours for a full run to take place. But in our hospitals, because they do these tests to a larger degree in volume, we'll be doing perhaps 200-300 or even more than that in any day in our labs. There's a need to make sure that our labs are doing this in a very efficient way. And therefore, they will do batch testing. They will do several runs in a day. And because of that, depending on when that test sample comes to the lab, you may end up having the results come out a little bit later, longer, rather than just simply at 3 hours. And therefore, to make sure, therefore, that these tests are properly done, if necessary, confirmatory tests are done also to make sure the test results are correct. We tell our patients that the test results may take sometimes as long as 24 hours, but in the majority of patients, in fact, it's not more than about between 3 and 5 hours. It's the same test that's actually done, a similar test is done in the borders, except that the scale is different. There's a lab that does this, but the numbers that they deal with, in fact, are much smaller. It's maybe 1 or 2 tests in a day. Sometimes, perhaps on a busy day, we anticipate it might be a little bit more. But the scale is very different from what we see in the hospitals, where they're doing more than 300 tests in a day.
So it doesn't make sense for GPs to do a swab and then send it to the hospital?
Yes. So at this point in time, we don't think that's necessarily the best thing to do for them. We want to empower GPs to have the test and ability to test for this as much as possible. But we're really looking at new technologies, as Yisin has mentioned. And what really would help us is if we could have a point of care test, something easy enough to do, which can give a result as quickly as an hour, maybe even faster, and that allows real-time decision-making to take place where the GP is. There are several tests that are being developed at this point in time, but none have reached the stage where we think it can be actually commercially available, but we're keeping our eyes very closely on these developments.
I'd like to pose this question to Liang and Tiki. We've got more than 30 people writing in to ask, the March holidays are coming, the June holidays are coming. Is it safe for people to travel? Should they cancel those holidays? Tiki, would you like to start?
I would say that if the travel is to areas which has not seen a lot of local transmission, okay, then I would say it's fine to go ahead with that. But if you're talking about, Iran, northern Italy, South Korea, then I would if it's non-essential travel, I would think twice. I mean, that's really my view at the moment.
Right.
I think this is going to be part of the new normal for a while, to look into cutting back on more non-essential travels and to look at which countries where we see an incremental rise in cases that suggests that there's a lot of community transmission going on.
No, but some of the rises has been so quick, within a week or so, from 0 cases to over 1,000 cases, or quite a few European countries have several hundred, fast approaching 1,000 cases. So what is the cutoff point? If I'm planning my holiday, which countries are considered safe? And then some of the, I think Tiki mentioned earlier, some of the less developed countries may not be spotting people with the disease. So they may not be saying that they have cases. Does that make them a safe country to go to, or does that make them a very unsafe country to go to?
I think it depends on your threshold of risk taking, and even within countries, there are areas like in northern Italy, so northern part of the country. In Korea, it's mostly Daegu, not the whole country. So I think you just have to make, let's say, a judgment based on your own individual risk levels. That's really, I don't know, Liang.
We do put out travel advisories that will help Singaporeans to perhaps have a better sense of whether or not it's safe to travel. And in fact, the advice we give is very similar to what Tiki has mentioned. There are countries where we have recognized that there in fact is quite a bit of community spread. And in those settings, it would not be wise perhaps to engage in a lot of travel to those places unless it's absolutely essential. And therefore, if it's non-essential travel, probably it's best to defer travel to those places. Irrespective of where you go, you can still do something to safeguard yourself. In other words, avoiding crowded places, avoiding people who obviously are sick, washing your hands regularly, things like that are still important. In Singapore, overseas, it's still the same advice I'd give.
So if it's a family holiday, it's a non-essential trip, what's your advice? Cancel it.
No, you can flip this question on this head, right? Which is that should tourists come to Singapore? And the answer, obviously, we think is yes, because we think we've got a handle on the situation and that the community transmission at present, the risk is about as low as getting run over by a car in the street, for instance. And then you can...
Well, we have car accidents all the time.
That's right.
Yes.
Yes.
So, Yisin, what do you think?
Well, I think I will flip it the other way around as well. We also have to watch out in terms of introductions and importation as well. Yeah. But I personally, I think that Singapore is the safest place.
Right, so stay home. Have a staycation instead of a vacation.
You might have a new romance with the tourist attractions in Singapore. There's a lot of Singapore that most of us, even as Singaporeans living here for many years, we just haven't discovered.
With the school holidays, there may be crowds going to certain areas. Is that safe, or should people just avoid crowds? And again, I believe the government said they stopped inter-school sports activities, etc. Is that something that's likely to go on? And in fact, some people are asking, are we doing enough? Should we actually close schools, do more e-learning, have more social distancing? Are we doing enough?
Well, these are measures that are still in the bag. It's part of our armamentarium of possible measures that we could take on.
Right.
But it's important always to keep a watch on what the situation is and decide whether there are benefits to doing a particular measure, what the risks are, and what the disadvantages are. At this point in time, we don't think we've reached a stage where we need to necessarily tell all schools to close and close for long periods of time. That's occurred in several other countries. It's an attempt to try and prevent further spread taking place. We haven't reached that stage just yet. But it's not a measure that we have completely dismissed. It's always something that it's an option that we can consider. Even in schools, even though they've moderated the activities, it's also a situation where as we have a better understanding of how disease spreads and also what the risks are for school children, there might be a possibility for us then to perhaps restart some of these activities as well.
But once again, based on the evidence and the epidemiology, young children, the pediatric age group, has not been the one that's been most affected. So in that case, there are people who would say that school closure is a little bit of an overreaction in terms of the potential opportunity costs for children losing out on their educational opportunities. I mean, that's just...
That's a very good point. So children don't seem to get it that often or that sick. What about older people? What about all the community centres and all the activities that they have there for older Singaporeans? Is that something that perhaps we should think about reducing?
Well, the older population, the seniors among us, are certainly more vulnerable to infection. Many of them have other medical problems as well, and as a result of these medical problems, they may not have a strong immune system. They, in fact, are less resilient and more vulnerable to infections occurring. They may get infections and may get more severe infections as well. So from that point of view, it's important that we think about what we need to do, therefore, to protect them, their welfare, and sometimes it would necessarily be that we may want to think about managing the activities, managing where they are a little bit more carefully. But these are things we're studying, and these are things that as we also grapple with the current clusters that we have, we understand what the modes of transmission are. We'll take the necessary measures and we'll make the relevant announcements accordingly.
I think what is clear is that we are now having to consider a series of trade-offs. If you close schools, the kids are at home, someone has to look after them.
Yes.
And that has got consequences. If you keep all the old people at home and they don't interact, then there are other consequences as well. So I think it's all about balancing that risk now.
Right, so we try to live life as normal as possible. I do not have to rush out to buy toilet paper right now.
Oh, no, not right now, not at this stage. There's still enough in the shelves in our supermarkets.
I think another interesting observation, that Liang will confirm this, is that it seems to be affecting males more than females at the moment. And I've been asked this question by several journalists, what might be the reason? And apparently one possibility is that, at least in the context of China, there are a lot more smokers amongst the men than the women. And if you're a smoker, your susceptibility to respiratory infections obviously is going to go up. So Liang, do you have, or Kenneth, what's the pattern in Singapore in terms of males versus females?
Or perhaps Yi-Sin could
Yi-Sin,
share
maybe.
from my experience in hospitals.
We still see, and in Singapore too, we are seeing these patterns. We are seeing a little bit more male than the female, but I think it's too early to make a conclusion, because I think the conclusion will come when one day we have a better technique to be able to diagnose them. And this is what I call serology tests. Then you have a better picture. Whether smokers got it badly, a lot of theories about these ACE2 inhibitors, because you smoke, you enhance the inhibitors, and you enhance the virus attaching to the receptors and having more damage. Do not know, but this has been theories coming along in terms of the observations. But I think one of the very good message I would like to say is don't smoke.
Yes.
Yeah, of course.
No, but you see,
Very
smoking.
good chance to push that message.
No, but I totally agree. You shouldn't smoke, Tiki, but that doesn't make you more susceptible to the virus. You may make you more sick when you get the virus, but you're not more likely to catch the virus.
Yeah, but
because
we don't know at this
You
point in
don't
time,
know,
as I say, because you know
Right.
you have to wait till you have a better test, like serology test. Then you can make a better determinations whether that is a true observations that male got it more than female.
Right.
The other thing I would say that perhaps female are more aware of hygiene.
What do the guys say?
Professor Pang, the data coming out of China shows that males and females are almost equivalent.
Oh, okay.
But the disparity is that males, we are disadvantaged. We are at a higher risk of dying compared to females.
severe.
And that's what was shown in the other coronavirus like SARS as well. In SARS, females were higher in Singapore because it affected a lot of healthcare workers, but nonetheless, the mortality was higher amongst the men.
You know, this has been a very interesting discussion. We are running out of time. Anybody with any last minute things you think you absolutely have to say, would you like to, perhaps we start with Tiki and then we do a quick round?
Yeah, just very quickly, I'm going to go a bit beyond Singapore at a global level, and that's to highlight the critical role that the World Health Organization has played in sort of managing this whole crisis, mainly around sort of setting norms and standards for all countries to follow around the international health regulations, acting as a clearinghouse for information, and importantly, this convening power, being able to get the best experts to convene to try and sort of help countries and then providing technical support.
Right.
So I think it's a very important agency that has collectively tried to promote international solidarity and trust to sort of collectively work together.
So kudos to WHO. Yi-Sin, any last words?
Well, I still want to emphasize in terms of personal responsibility to the society. So if you are not feeling well, remove yourself, isolate yourself, seek treatment. And of course, you know, the usual things that we have to put in place in terms of hand hygiene, in terms of the masking, you know, surgical masks.
Right. Kenneth, Yi-Sin's taken your usual line.
No,
so
I'm going to expand on that, and I've said this many times as well. In fact, what is important for us to be able to control this is if people are responsible. So if you're sick, don't go into crowded places, don't go and continue social activities, don't go to work. See a doctor as early as possible. He may give you an MC to rest. Please respect your MC and stay at home. If you're not well, at the end of the MC, you're getting worse, please go back to the same doctor. Don't doctor hop, because if you do, then we may not be able to fully appreciate how severe your condition is, and we may not be able to treat you properly. So these are all very important. And of course, for our individual responsibility, as Yi-Sin has said, making sure we wash our hands, make sure we don't touch unnecessarily our eyes, ears, and our eyes, our nose, our eyes, our mouth, and these are the important things that will keep us safe.
Right, keep clean. Liang.
I think this virus is here to stay, at least until the end of the year. NUH did this very interesting survey where the medical officers were asked different questions, and most of them said, thanks to this outbreak, they appreciated life more. So I think we need to learn to live with this new normal, and suddenly we are seeing a great deal of acts of charity and benevolence that's coming from the community, and that's very heartening.
That's a lovely note to end this discussion on. There's still a lot of questions that people are asking, but I'm afraid that's all the time we've got. However, the Straits Times and the Big Story will try to get you the answers over the coming days. So keep abreast with the latest on the coronavirus in Singapore and around the world at straitstimes.com. And be sure to tune in to the Big Story at 5:30 p.m. every weekday. Thank you all. I'm Salma Khalid. Goodbye.